Hi, everybody. I'm Tanner LeBoyne from the Schizophrenia Society of New Brunswick. We're going to be talking about borderline personality disorder. So, what exactly is borderline personality disorder? Borderline personality disorder, or BPD, is a serious psychological and medical condition in which the individual experiences difficulty in regulating emotions. That's the easiest way to think about this disorder. Somebody with borderline personality disorder has extreme difficulty in regulating their emotions. BPD is often confused with bipolar disorder due to the severity and mood swings. But as we're going to see, borderline personality disorder is vastly different than bipolar disorder. The mood swings look very different. So what are some of the symptoms of borderline personality disorder? Intense, rapidly shifting moods. Unlike bipolar disorder, somebody with borderline personality disorder has mood swings that are more frequent. It's not like bipolar disorder where they experience an episode of depression over a period of time and an episode of mania over a period of time. They may be perfectly fine one moment and then the next moment be very angry or be very sad. Intense and inappropriate anger. It can also be repressed anger. Having an unstable self-image and low self-esteem. Having chronic feelings of loneliness or emptiness. Having a pathological fear of abandonment. This can be a real fear of abandonment or an imagined fear of abandonment. Pattern of unstable relationships. This does not necessarily just have to be romantic relationships. This can be relationships with their family members, their parents. It can be relationships at work with their coworkers or their boss. And engaging in self-destructive behavior, such as substance abuse, self-injury, excessive spending, or being promiscuous, eating disorders, either eating too much or not eating enough, gambling, risky driving, etc. Some of these risky behaviors are due to the impulsivity, but also sometimes they're due to the individual trying to cope with their illness. Having suicidal ideations or behaviors. And in some severe cases, somebody with borderline personality disorder can actually experience something called psychosis, which is a disassociation or a break from reality. So what causes borderline personality disorder? So like most disorders, there is no one specific cause, but there are some contributing factors. Having a genetic predisposition is a risk factor. So a genetic predisposition is a family history. So if somebody in your family has borderline personality disorder, you are at a greater risk for developing the condition. People with borderline personality disorder often have differences in brain structure, especially parts of the brain that are involved in regulating emotions and impulsivity. And experiencing abuse or neglect as a child can be another risk factor for developing borderline personality disorder. So how is borderline personality disorder treated? So there are many different treatment modalities. Often these are used in conjunction with each other. So a medication. So unfortunately, there are no specific medications specifically designed to treat borderline personality disorder. However, your physician may prescribe some certain medications that will help alleviate some of the symptoms that are associated with borderline personality disorder, such as depression, anxiety, and sometimes even psychosis. Other treatments include dialectical behavioral therapy and cognitive behavioral therapy. So I'd like to thank you all for taking the time to watch this video today. I hope you found it very helpful and informative. And for your benefit, in the description, I've included some contact information if you're seeking help in the Miramichi area. Of course, if you're in crisis, please call 911 or proceed to your nearest emergency department as soon as possible. Thank you, everybody.